Let's see if the attendees are starting to come in. All right, good morning, colleagues, and welcome to day 4 of the fourth day of the first session, which is the Faculty of Dentistry of our research week. Remember, the topic for this particular research week is how we contribute to the SDG and Agenda 2030. So I'd like to welcome everyone here today. We will have 5 speakers today from the Faculty of Dentistry who will be speaking on a range of topics from teaching and learning and research to services to educational transformation, as well as the development of research niches. I want to invite all the participants and attendees today. If you do have a question, please pop them in the Q&A section, which you will find in the bottom right-hand corner of your screen. And we will do our best to make sure that the presenter gets the question and would be able to answer you appropriately. So welcome again, and without further ado, I would like to invite our first speaker, who is Professor P Brijlal from the Department of Oral Hygiene. Professor Brijlal joined the Faculty of Dentistry in 2002, and she is the current head of Department of Oral Hygiene and the coordinator of the Bachelor of Oral Hygiene program, as well as a lecturer. Her qualifications include a Bachelor of Oral Health, a Master's in Dental Public Health, and a PhD in Dental Education. The profession of oral hygiene is close to her heart, and as such, she has expanded her knowledge and skills to support her teaching, clinical practice, community engagement, and research practices. She is also the University's South Africa representative on the board for dental assisting, dental therapy, oral hygiene of the HPCSA, where she serves as a vice chair and chair of the Education, Training and Registrations Committee of the board. Professor Brijlal, welcome, and you may take it away.
Thank you, Prof. I'm going to share my screen. But before I do that, and due to bandwidth constraints, I'm going to switch my camera off. Prof. Titus, is that clear?
It is clear. Please put in presenter mode. Fantastic. Good.
Thank you. Good morning, colleagues. My topic of my presentation today is on teaching, learning, and service, translating research to guide policy and practice, and also it responds to the SDG 3 and 4, which relates to the promotion of well-being and quality education. So I'm going to first highlight the role of higher education. Now, universities are responsible for research and scholarship and innovation, but in addition, they serve as agents for change within communities, as well as for the adoption and dissemination of knowledge generated. Now, a major challenge that many researchers face is how to translate their seminal research findings into policy and practice. So translational research is an approach to research that seeks to produce more meaningful, applicable results that can make a significant impact on the lives of people. Now, this presentation will provide a reflection on the research activities within the Department of Oral Hygiene, showcasing some of the translational research projects in which the research findings are moved from the research bench, from the researcher's bench to classroom settings, practice settings, and even the community. Now, seminal to the research agenda in the department is the persistent drive to integrate research with student learning experiences, skills development, and service provision. Hence, the research activities that we undertake are very interrelated between being patient-orientated, population-based research, and even student-orientated, with a large focus on teaching and learning. So I'm going to ask the question, have you completed a research project? And if so, how did you disseminate your results? Now, and importantly, and too often, the neglected step in the research process is the dissemination of findings. Now, the gaps in research dissemination limits the spread and the impact of the research. Now, when you disseminate research, there are strategies that are often not well developed and put into practice. And sometimes good and necessary research does not reach those who most need to know about these findings. Now, in your protocol, you would find that there's a purpose statement. Now, when one decides to embark on research, this purpose statement in the protocol proposes what the research goal is and will accomplish. And it could read something like, this research serves to inform policy development, or it serves to guide the teaching of health behaviors in children with a disorder, or it will say to create awareness about oral health, or to inform curriculum development, or to inform strategies for student support. Now, another feature in a protocol is the dissemination statement. Now, much of the statements about disseminating research centers usually around the publication of research findings in peer-reviewed journals, but dissemination also includes informing stakeholders, like participating physicians, patients, and the general community, or providing feedback to an organization or an institution. Now, when it comes to dissemination of results, for knowledge translation to occur and to bring about meaningful change to the stakeholders, appropriate dissemination must occur. And this could be in the form of publications, report writing, and presentations at conferences and seminars, through various media, etc. But importantly, it should transpire through application. Now, application refers to infusing findings into practice, and often we use the word implementation as a common synonym for this whole process of change. So there are some factors that one needs to consider. Now, in order for translation to occur, you must consider the target audiences and the settings in which research findings are to be received. And it will also involve communicating and interacting with wider policy, institutional or health service audiences in ways that will facilitate this research uptake in their decision-making processes and in how they practice. So another factor to consider is funding. Now, given the increasing amount of funding allocated to research by governments and foundations and even non-governmental organizations, it is necessary to critically explore the issue of translating research to policy and practice. Now, aside from financial resources allocated to research and development, the translation of research findings into policy and practice ensures the accomplishment of one of the core missions of the university, and that is discovery and innovation. Hence, it is so critical to think about how our research translates into educational or even health policies, educational or clinical practice, or how our colleagues could be supported in how they teach, in the creation of conducive learning environments, or even in providing care. Now, research can improve learning and teaching, as we all know, and even patient outcomes, but it only happens then if the evidence-based practices eventually find their way to the classrooms or even into the communities that we serve. So with regards to the research agenda in the Department of Oral Hygiene, now in the department, research is usually related to areas of expertise and interest of the staff, but it also will embroider around things like learning, teaching, skills development, and service provision, which is our core business. Now, projects could either be individual and collaborative, and it could happen within the department and even across departments and across institutions, but then it could also be related to student and staff studies like PhDs and masters. And we even have in the Bachelor of Oral Health program an undergraduate research module where they would actually undertake research and produce a report. We cover quite broad niche areas like curriculum development, learning and teaching, student development and needs, and This is largely on the psychosocial and academic functions, dental public health, where we look at special needs groups, early childhood development, health promotion, and policy as well. And then we also have a focus area on professionalization of oral hygiene, and we look at continuous professional development and even curriculum benchmarking, which is something that we're going to be very focused on in the new year. Now, for this presentation, whilst there might be other publications and progress made towards application, I will present 4 recent projects illustrating how translation occurs from research to practice. So the first one I will focus on then is the competency-based clinical assessment instrument for exit-level Bachelor of Oral Health students in the program. So the background to this study was that it started off from a departmental project on curriculum evaluation. Now, like in all programs, curriculum review is an inherent feature of our program as well, and it involves an iterative process of refining and evaluation over the years. Now, assessments for the different year groups are also reviewed in this process to ensure continued alignment and institutional best practices. So we have periodic reviews of our clinical assessment tools as well, and that served then as the impetus to appraise the current assessment tool that we had and review the methods that we used to approach the assessment. Now, this whole notion of having to review current assessment practices is in line with the need for clinical teachers to be quite innovative in providing evidence-based and reliable assessment instruments within this rapidly evolving academic context that we find ourselves in. So the whole aim was to develop a formative competency-based assessment instrument for the sake of making it robust and fit for purpose for our exit level students. And the method that we adopted was qualitative in nature, excuse me, and it employed the nominal group technique. And this technique is a consensus gaining approach, which was used by this designated group of academics to develop an assessment instrument then that was what was aligned to the principles of assessment. Excuse me. So the staff members had expertise in clinical teaching and assessment, and they were also involved in the previous instrument development. So they're quite informed with the whole process of having to review the instrument. And this process included an extensive review of the literature on clinical assessment with regards to oral hygiene. So in terms of the results, the core domains we looked at was largely on ethics, professionalism, and patient care, patient treatment, planning and implementation. And these were, the core elements that formed the assessment. The instrument was designed around the principles of assessment criteria, and we also aligned it to the learning outcomes of the module and the program. Formative feedback was foregrounded as a central feature to support the student learning and also to monitor the progress of the students. And this tool was designed for online activity where the staff could go online and provide a mark and feedback to the students. In terms of dissemination of this research, it culminated in a publication, and this manuscript was published this week already in the BMC Oral Health Journal. And also there was an application to it. Within the department, we gained consensus on how we're going to use the tool, and also it served as a form of calibration for staff to become very familiar and approach the tool in a similar fashion. So what changed for us? The instrument is currently being used for a continuous formative clinical assessment, and we've had student and staff feedback on the instrument, and so far it's all good. Students also now have access to their grading. It allows for regular feedback, transparency. They're able to see how we grade them. They're able to see all the feedback we're providing, and we also use it as a form of monitoring their progress, They can also monitor their own progress, and each student has a confidential document, so no one else can see. Well, the other students cannot see what their scores are, apart from the staff who are providing input into those documents. And then we also have an opportunity then for future research as well, because as we indicated earlier, that the instruments are very open to change as things change in higher education platform and new developments occur in assessments. There's always room for future research. The next project I'm going to talk about is on the module evaluation of 2 modules within the program of the second years, and that's the oral health promotion module and the local anesthesia module. Now, the background to this was that it also emanated from a curriculum evaluation project, and it was a collaborative project between the Departments of Oral Hygiene and Maxillofacial Surgery. The aim of the project was to evaluate the curriculum and the pedagogy of the 2 diverse modules in the second year program, and to also explore any contextual factors that could be affecting their teaching and learning. The methods that was employed was a mixed method approach, and data was sourced from lecturers, clinical teachers, students, and also expert input that was staff that were very knowledgeable in the area, and also documentation. The modified concept indicator method and the emergency remote teaching environment frameworks was used as a guiding format for data collection. And the tools included things like questionnaires, a focus group discussion, and document analysis. So the results that we derived from the study was that students have diverse learning styles, even lecturers have different styles of teaching, and there are also contextual challenges. And there was a lot of suggestions made for improvement in the modules. And the authors also argued for a revised hybrid approach eventually to delivering the Bachelor of Oral Hygiene program based on the feedback from the participants. And they also proposed a vision that would be a system to inform research, or a system informed by research rather, with support built into the university ecosystem. And the dissemination of the results was in the form of a publication where the article was published in the African Journal of Health Professions Education. There was also a journal club presentation looking at student reflection as a framework for learning, or as an approach to learning. And the application was in the consensus that was made to embed all of these changes into the modules as well. And what changed for us, it was structural in nature. Within these modules, there were presentations and tasks embedded, as well as a reflection where students then had the capacity to reflect on their learning as a form of evaluation. And this student reflection tool, like I mentioned, was presented at the Faculty Journal Club, and there's been a huge interest in using reflection then as a tool for learning. The next project I'm going to highlight is the Sparkle Brush program. And these research findings emanate from a PhD project by Dr. Naidu on the oral health status of children with autism spectrum disorder. And in that study, it revealed that there were unmet dental needs for these learners at school, and there were challenges during professional dental visits and oral care, especially with having to manage the patients during these dental visits. And there was a huge need for a preventive oral health care program in most of the schools. So the dissemination of this project happened in the form of a publication, and the article was published in the BMC Oral Health Journal. And the application was that there was collaboration between the universities of KwaZulu-Natal and the Western Cape, and there was an intervention that was developed, and in these schools there was oral health programs implemented, and they are being monitored. Further to that, there was opportunities for staff and students to provide care at the schools that what we term as service provision, and also there were service learning opportunities for students as they became involved in not only just providing a service, but it provided a learning platform for them to experience what it feels like to promote oral health and to then apply the knowledge learned in a classroom setting and translate that into a clinical setting or into a school setting or community-based setting. So what changed was that this increased collaboration between the two institutions, that's the University of KwaZulu-Natal and the University of the Western Cape. And also there was a collaboration. Sorry?
You have 3 minutes left. I'm sorry to interrupt.
Okay. All right. And there were also 686 learners that we reached. And these are just an example of some of the photographs taken during that process. The next one is on the Early Childhood Development Educators Project, and this is an ongoing project. The setting was in early childhood development centers, and the NPO in Khayelitsha contacted UWC to run a program on the empowerment of educators, and the intervention took the format of an interactive workshop, and these workshops reached at least 108 educators, 39 centers, and 5,500 children and parents. And the aim was to obtain baseline information on oral health knowledge, practices, and attitudes, and also their responses to oral health actions pre and post intervention. And the method was pre-test questionnaires and post-test questionnaires. And the dissemination again was through publication and application. The article has been accepted and awaiting publication, and the dissemination then is in the form of an application where we have a cyclical review of the intervention. What changed? Structurally, there were additions to the self-assessment questionnaire, and there was also feedback and follow-up on the ECD application as planned with these educators. And there will also be an outcome evaluation in October. There's also research, service provision, and service learning opportunities for both staff and students. This is a glimpse of some of the activities. So, with regards to knowledge translation, there are multiple opportunities in South Africa, and there's an access to wealth of information and data. There's lots of expertise in the department, in the faculty, and even in the university. And UWC provides excellent research development opportunities for both staff and students. And what was good was that we had a department project that was registered that evaluated and sought to improve the curriculum that allowed all of these projects to occur. Challenges, as usual, would be time constraints, curriculum, service, community priorities, and even staff and student commitments, which can provide constraints on how we do these research projects and implement them and disseminate the information. So, in conclusion, I want to say that any research must make the stage of translation, and the researchers should include stakeholders themselves. It should include students, staff, industry, policymakers, etc. And that's the only way that translation can occur. So doing research should not be about them, but it should be with them and for them. Now, UWC needs to create a footprint, and in terms of the research that we produce, we must endeavor to increase the UWC footprint, not only on paper, but also by translating research into practice, whether it be in classrooms or in the community. But the ultimate contribution must be towards the service of a better society, and that is transforming knowledge into action. And with that, I want to say thank you to my colleagues for your attention. And on behalf of the Oral Hygiene Department, I thank you then for listening to our presentation. Thank you, Professor Titus.
Professor Brijlal, thank you so much for that presentation. I love the ending, from, which speaks to our institution's values in terms of from hope through knowledge, through action, and, that transformation really comes through. I'd like to check if there are any questions. I see there's one in the chat from Dr. Lundie. He's saying that the BOH research projects to enhance learning and teaching, are the projects aligned?
Yes, Absolutely. And that's why I said it's intersected. Whatever we teach, we translate into practice. We take the students into the community so they get experience through experiential learning or service learning, where they can provide a service and then bring into their practices within the community, whatever they learn in a classroom setting. It's aligned to all the outcomes in the modules as well as the program, and the assessments are also aligned within that parameter. So there's a link between what we do in the communities and what we do in the curriculum.
Excellent. Good. Thank you for that. If there are no other questions, I just wanted to check I'm really impressed with, especially with Project One, where you speak about the competency-based clinical assessment and the instrument that was used. I was wondering how staff one was trained in terms of the instrument, but then also one of the key facets of that particular intervention was the idea that formative feedback is given. And I wanted to know how staff are trained with this feedback, because very often in terms of assessment, that is lacking, the element of feedback. And I was just wondering how that particular area was addressed. And if you don't mind, just stopping your share so that we can load up the next presentation in the meantime.
Sure.
Thank you.
So with regards to the instrument, firstly, the staff that do the assessments or that perform the assessments on these students are the ones that develop the tool. And then we obviously had experts or we had students also reflecting on the tool itself, providing their input. And core to that was about feedback. Feedback is given in a clinical setting on one-on-one with the student as they proceed throughout the care process of the patient. It's provided again at the end of the session, and it's provided in written format on this online assessment platform. And the students can go in and read the feedback, and then they have the opportunity to engage the clinical teacher further on a personal basis, and talking about the challenges and the opportunities for learning, what went well, what went wrong, and how they could improve. And we also use the preceptor model of feedback, which is using a learning opportunity to, at any point in the given clinical situation, where we can provide on the spot feedback as to how they're progressing, or any mistake that might have occurred. We use that then as the learning opportunity. And it does not have to be everything that went wrong. It could be one point that you pick up that's imperative for that learning opportunity, and you take the student through that process during the clinical session. You pick it up again at the end of the session, and you also discuss your marks with the student. So feedback is very engaging. Again, it's talking to the student, talking through the whole process with the student, inviting the student for a personal visit to your office where you can engage them further, and then providing detailed notes on the online platform that both the staff, all the clinical teachers, as well as the student can view the feedback. Is that sufficient?
Fantastic. Yeah, no, it's amazing, because it speaks about the reflection also in action and on action. Well, thank you very much for your time today, Prof. We're going to move on to the next speaker. It was, who is Professor Geerts. Wonderful. We'd like to welcome Prof Geerts. She is a professor in the Faculty of Dentistry and is currently serving a second term as Deputy Dean of Research and Postgraduate Programs. Prof Geerts qualified as a dentist in 1985 and as a specialist prosthodontist, in 1992 at Stellenbosch University, and she also has a postgraduate diploma in implantology and a PhD in removable prosthodontics from UWC. She has extensive experience in undergraduate and postgraduate teaching, having convened the specialist training program for many years. She has supervised and examined numerous master's and doctoral students, and her research interests are prosthodontics, oral health-related quality of life patients, clinical research, and biomaterials. She convenes the Temporomandibular Disorders Clinic in the Mitchells Plain Oral Health Facility and has presented her research at national and international conferences. She served in leadership positions at academic institutions and professional and scientific organizations, serving as head of department, as deputy dean, President of both the Academy of Prosthodontics of South Africa and the International Association of Dental Research, the South African division. And with that, I welcome Prof Geerts.
Thank you, Chair, for the introduction. Good morning, the DVC, Professor Phillips, Director, colleagues on UWC campus and also here at Dentistry. Thank you for the opportunity to give an overview of the research landscape at the Faculty of Dentistry. And to reduce interference with live data streaming, I will now switch off my camera and continue with the presentation. The Faculty of Dentistry, UWC, operates on a platform shared with the Provincial Government of the Western Cape Health, with main sites being Tygerberg and Mitchells Plain Oral Health Centers. But there are several other sites, such as amongst others, the Grote Skuur, Red Cross, Tygerberg Hospital, and several peripheral and rural outreach sites, also using our mobile facilities. Hence, it is a small faculty with a large footprint in the Western Cape. In order to create a win-win situation and optimize efficient use of limited resources, it would be ideal to align our research endeavors with the research terms of reference and priorities of the different strategic partners and different stakeholders in health on the platform. Now, who are these partners and stakeholders and their policy documents in terms of references guiding the research landscape at Dentistry? And this research week at UWC is about SDGs. And starting with, obviously, with UWC, the institution is firmly committed to solving challenges set out in the United Nations 17 SDGs relevant to the African continent. And we know that rankings recognize institutions that address those SDGs. But besides the SDGs, there are other important strategic partners that guide our operations. And UWC also prioritizes the National Development Plan. Of course, most of us also know that Faculty of Dentistry is a World Health Organization collaborating center for oral health. And World Health Organization relies on collaborating centers to provide evidence for developing policy and implement strategies. Then the Western Cape Government Health adopted measures to set the health research agenda, promoting firm linkages between research, program management, and service delivery. PGWC is also aligned with the National Health Research Policy Framework. Then our dentistry colleagues know that the faculty has a long-standing relationship with the International Association for Dental Research, the largest organization for oral and craniofacial research globally. And lastly, the International Dental Federation, one of the oldest organizations in dentistry, fosters best practices in oral health science and works with the United Nations agencies, such as World Health Organization and, of course, the United Nations SDGs. So all these stakeholders and strategic partners are basically intertwined and are all an important voice in the oral health arena. So in order to make sense or to strategize our terms of references, I actually made a list of the terms of references and research priorities that are promoted by all these organizations and institutions. And in no particular order of importance, I listed them and found that most of them share priorities. So they are not mutually exclusive, but inclusive. And I will return to these terms of references and priorities later on in the presentation when I analyze what is being done at the faculty. So our partners need info on fighting communicable diseases like HIV and TB. They need information on fighting non-communicable diseases like cancer, cardiovascular disease, diabetes, who share risk factors with oral disease. They need information on social and economical determinants that affect health and disease. Information on lifestyle, diet, and sugar. And here, of course, sugar is very important in terms of oral disease. They need information on epidemiology and burden of disease, particularly for low and medium income countries, where the capacity to collect this information may be compromised. They need information on substance abuse, including tobacco and alcohol. They need information on oral health promotion, prevention, and primary health care. They need information on they need information on international collaborative research priorities and how to develop them. They need information on clinical and biomedical research and creating a continuum from discovery to implementation and from basic science to clinical practice and policy. And Professor Brijlal already emphasized that in the previous presentation on how important it is to translate knowledge into practice and policy. And I salute the Department of Oral Hygiene for really putting knowledge into practice. Well done. And that's also why I invited her to make a presentation here, because Chair, we had a research day now already months ago, where our theme was translating knowledge into practice. So it is very important within our faculty. And then obviously very specific things in the field of dentistry is phasing down on the use of amalgam and finding cost-effective alternatives. We need information on cleft lip and palate. And as you know, that 1 in 500 children are born with a condition like that. So it's very prevalent. Noma, a disease of poverty. We need to address the 90-10 gap. As we know that 90% of the research done caters for the needs of high-income countries, and that is 10%. Health system policies such as universal health cover and equal standard of care. And this, of course, for dentistry includes access to affordable medicine and access to fluoride-containing toothpaste. Something simple as that. And then, of course, relevant and translational research, as Professor Brijlal already emphasized in her presentation. So please don't try to read this slide. But what I've tried to do here is to list the columns according to our strategic partners and list all their terms of reference or research priorities, and all in the columns, the text that is highlighted in the same color are actually shared terms of references. And these colors actually show that all the stakeholders and strategic partners share common priorities. So what does that mean for the academic staff member in the Faculty of Dentistry? What determines the dental research? So within that bigger picture, of course, the individual in the department also has his or her personal interests and passion. Needs to find out whether there are existing collaborations in niche areas, or maybe not, and they need to be developed. What are the support systems and skills development opportunities? What are the finances? What is the research culture in the department? What are the resources in terms of access to data, access to records and access to disease burden? And here the Faculty of Dentistry is really fortunate, and I will show you later. So if you join the faculty, you will be one of about 63 permanent academic staff most of them in joint appointments, UWC, PGWC, with responsibilities towards both partners. This staff complement is assisted by a small group of emeritus, extraordinary, and adjunct professors, as well as a complement of part-timers who are mainly employed for clinical training and student supervision. So it is a small faculty with a small complement of staff, and that also illustrates the relatively low numbers of publication outputs. And the table on the left-hand side shows what the total number of publications is for the period 2013-2021. And it includes all publications in accredited and non-accredited journals, all disciplines, all types of articles, reviews, communications, case reports, in vitro and clinical studies. And these data have been sourced from Convergence and faculty reports. So what we find is that in the beginning of this period, it seems that there was an issue with the publications in non-accredited journals was rather high, resulting in a loss of potential income for UWC. And together with that, the percentage of publications in predatory journals also appeared to become a growing issue. But an awareness campaign, both within the faculty and library, seemed to have carried fruit and reduced this practice. Although it's not eradicated, and we need to just keep going with our awareness campaign. Prior to 2019, most publications were in national journals, so in the South African Dental Journal, South African Medical Journal, and African and South African educational journals. From 2019, this trend seemed to change with most publications in international journals. It is not always possible to box a publication within a particular discipline, because often research projects and publications cover several fields and staff of different departments that collaborate. Keeping in mind this limitation, radiology, public health, pathology, and biomaterials were most productive. As you may have seen from the examples that Professor Brijlal gave in her previous presentation on education, teaching and learning, and the effect, especially in the clinical environment, you cannot box a particular project, right? This is teaching and learning, and this is clinical. So it is difficult. So I want the audience to keep that in mind when looking at these figures. Of a total of 530 publications, 45% reported on original research, 31% were on case reports, and 23% were reviews and communication. It is interesting to note that the percentage of case reports highlighted in yellow here during the past 9 years is exactly the same percentage of case reports that were reported in a previous 8 years cycle. So the number remains the same, but also the profile in terms of types of publications, it seemed to be quite stable over the past 15 to 20 years in the Faculty of Dentistry. Now, zooming in on 236 original research publication, I separated the clinical studies from in vitro, lab-based research, and education papers. Again, it is not always possible to box in papers in a particular category, so hence it's open to some interpretation. The majority of research papers used clinical data based on patient records, patient surveys, and questionnaires, and the occasional retrospective, cross-sectional, and or prospective trial. Now, then again, zooming in on the clinical research paper, about 131 of them, the majority, or 57%, generated data from surveys, questionnaire, and interventions, and 43% used existing patient records. That's a rich resource of data for our research purposes. So this also illustrates the contribution and the importance of accurate patient record keeping that is a valuable resource at the faculty and a result of service rendering activity. So we can have so it's an opportunity for creating win-win situation between different stakeholders. So the last part of this presentation will provide an overview of how well the faculty actually addressed the terms of references and research priorities of our strategic partners. It addresses the SDG 3, and it takes us back to the initial part of the presentation where I listed the terms of references. First of all, fighting communicable diseases. The faculty researched oral health in HIV-positive children, researched the link between HIV and periodontal disease, researched knowledge, attitudes, and practices of healthcare workers, and studies human papillomavirus and carcinomas. In addressing non-communicable diseases, dentistry staff is researching diabetes and oral health, saliva as a diagnostic tool for systemic diseases, brush cytology and genetic work in cancer. In terms of epidemiology of burden of disease, work is performed in epidemiology and burden of disease related to caries in vulnerable populations, oral cancer in Africa and sub-Saharan Africa, and the impact of tooth loss on oral health related quality of life. In terms of preventing and treating substance abuse and creating awareness, work is performed on oral effects of substance abuse, including tobacco use and resulting treatment needs. A special mention here on sugar consumption. A study is being performed on the sugar content and accurate labeling of baby formula, for example.
Prof, you have 3 minutes.
Thank you, Chair. In terms of cleft lip and palate, staff at orthodontics is involved with an international consortium, systematically researching prevalence, treatment, and outcome of cleft lip and palate. Numerous publications have resulted from that. Prosthetic dentistry has been publishing clinical trials related to removable prosthodontics and oral health-related quality of life following rehabilitation with dentures. And that is an example of addressing the 90-10 gap between poorer and high-income countries. Community dentistry has been researching the availability of basic oral health care packages in Western Cape, KwaZulu-Natal, and researched the fluoride content and labeling of toothpastes in South Africa. Several initiatives have been undertaken to understand and eventually support the health force in the fight against HIV, early childhood caries, and Professor Brijlal also mentioned it in her presentation, and also oral cancer, particularly in rural areas. A special mention to the work done on teledentistry screening, the oral health section of Road to Health chart, and an oral care tool for children with autistic spectrum disorder. And Professor Brijlal also referred to that in her presentation. Now, in summary, Chair, publications have remained stable over the past 9 years in the Faculty of Dentistry. Case reports and reviews have been significant contributors to publication outputs and revenue for the university, about 55% of our publication output. About 45% of publication outputs is based on original research. And this research addresses most of the terms of references and research priorities of our strategic partners. Clinical records as a byproduct of clinical service rendering are a valuable source of data. And faculty has been consistently researching and publishing according to these terms of references, including SDG. Then in terms of recommendations, the faculty needs to continue building on strengths and niche areas and creating win-win situations. As Professor Brijlal in the previous presentation also alluded to, we need to improve translation from research and discovery to implementation and establish a continuum from basic science and to practice and policy. The data presented here today was based on a draft spreadsheet that my office put together. However, developing a database system of publications according to specific features, characteristics, and criteria will provide richer information to improve surveillance and facilitate reporting to our strategic partners. And then, Chair, last but not least, in the previous presenter also alluded to that, is it will also allow us to establish how much research material remains unpublished. Thank you, Chair.
Prof Geerts, thank you so much for your presentation. It was very insightful. You are welcome to stop your share and switch off your PowerPoint. You know, I'd like to congratulate the Faculty of Dentistry for your sustained publication. And you know, I have a question in terms of the case reports. Do you know whether the case reports inform some of the practices that happen on the clinical, in the clinical setting or in on your clinical teaching space?
Yes, Chair. I think looking at the database that we have, many of the case reports are published in the National South African Dental Journal, and they are a very important source of information for also the private practitioners who are practicing not in an academic environment, but who are on a daily basis are you know, faced with particular cases. We also have a rich database of, for example, radiological records. That we actually have a radiologic imaging library that has been an extremely rich resource for publishing these cases, both routine and common cases, but also the more rare cases. Then together, these case reports obviously present a particular case, but they are often supported with a short literature review as well, giving some background knowledge. So they are an important source of continued professional education for the whole dental profession. And in that regard, I think that the dentistry faculty plays a big role. Thank you.
That's wonderful. Thank you for you know, the continued interaction with the research agenda. Good. Prof Geerts, thank you so much. I don't think that there are any questions, colleagues. I really would like to invite you to ask any questions in the Q&A. If there are any questions for Prof Geerts, you can still put it in the Q&A, and she can also check it if there's anything that springs to mind. We'd now like to invite our next speaker, who is Dr. Samuel Lundie. Dr. Lundie is a teaching and learning specialist in the Faculty of Dentistry. His main responsibilities are curriculum development and implementation development of academics as teachers, student learning development, and support and research. Samuel holds a PhD in curriculum development, evaluation, and innovation from Northwest University. He also obtained a master's degree in learning and teaching and received cum laude for the Best Student Award from the University of Pretoria. Samuel's experience in the higher education field is punctuated by the development and facilitation of several credit-bearing short courses for the personal development of lecturers and in-service teachers across South Africa. Samuel was the HOD and program leader of short learning programs at Northwest University, responsible for the development, management, and delivery of short learning programs. He's also the founder of Assadia Training Institute, and as a researcher, he's the co-author of a book titled Quality Assessment for South African Teachers, and has published several handbooks on assessment, moderation, and mentorship. Samuel believes that the key to transforming teaching and learning lies in empowering teachers through curriculum development. And with that, Samuel, welcome, and you may go ahead.
Thank you, Chair. I just want to I'll say good morning, colleagues and Chair. Thank you for the introduction. Yeah, it was very interesting topics this morning. Colleagues, Prof Brijlal presentation focuses on the translation of research into practice. A strong focus on the relevancy of research. And then Prof Geerts as well shared with us information on the Faculty of Dentistry research landscape, and she also specifically referred to the external agents or the external partners. Now, my presentation will focus more on the links, to get a closer link between research and teaching, as well as closer links between research and the community, the external agents, as well as a closer link between teaching and the community, the external agents. So it was very interesting for me to listen to the previous presentations. And thank you for listening to us. Melanie mentioned in the chat that the average, she mentioned this morning, that the average of attendance was, the week was about 20, between 10 and 20. But now we see we are almost 40. So thank you for your time to listening to us. All right, so colleagues, as I said, my topic is to look at how the Faculty of Dentistry is bridging the gap between research and teaching, and as Professor Brijlal already demonstrated practically with her projects, how her department translates teaching into practice. And I will also report on this, but more specifically from a educational perspective. I'm not sure if you can remember, but we have introduced in 2021 a model called Community Engaged Research-Led Teaching Model. Now, this model creates a platform for the faculty to combine research, teaching, and the community, the external agents. So my presentation will then mainly focuses on the reasons, what is the motivation, the reasons to develop closer links between research, teaching, and the external organizations. Then briefly, I've done it in detail in 2001, but just a sort of a recap on the community engaged research-led model, and then a report on, and it correlates with Prof Geerts' information, reports on how the faculty's research projects and publications, and then something new for our faculty is derived from this model is to report also on the engaged research-led projects and publications, and then I will conclude. Right, so I want to take a step back. We have a new dean and we have a new proposed strategic plan, and I've looked at this plan, and I've looked at the vision statement, and I've asked myself, okay, what from a what can we do to assist the dean and the faculty with the implementation of the proposed faculty strategic plan? And when we look at the vision statement, it's already clear that we can distinguish 4 focus areas in terms of teaching, learning, training, and research, as well as the community. So looking at the model that we have introduced in the faculty, there's a clear correlation between the strategic focus areas and the strategic and the research areas in the faculty. Now the challenge and the question is how can we combine? And as Professor Geerts mentioned in the previous session, where she provide information in terms of the different disciplines, as well as the different departments. We have 56 modules in the department. How do we combine it? How do we align it? And that was why I asked this question to Professor Brijlal, is because to make impact, we need to synchronize, we need to align it. So the question is, how do we combine, how do we organize situations of collective inquiry to contribute, first of all, to enriching learning experience of the students, compelling research, as well as meaningful societal engagement, and also contributing to the SDGs. And so, to put it bluntly, colleagues, is how do we put our ducks in a row? And what's very interesting is the uniqueness of the Faculty of Dentistry, and it was mentioned by Professor Wood last week from the HPCSA after the accreditation visit. The uniqueness of the faculty is if you look at how the faculty curriculum is structured, with a very strong focus towards the community. So we can interpret that the faculty curriculum is not only a competency-based curriculum, but it's also a community-based curriculum with a very strong focus on service to the community. And I want to join late Professor Wendy McMillan in terms of where our students learn, we teach our students, and our students learn by rendering a service to the patients and to the community. And that makes the faculty very unique, but it also creates wonderful opportunities for us for research to enhance the well-being of the community and also then contribute to the SDGs. And we also use the community, the input from the community, to enrich our teaching and learning. So in short, the community engaged research-led learning platform or model is a platform of combining, integrating, curating research with teaching, learning, with the aim of enhancing the well-being of the community, to deliver a service to the community, but also to strengthen the research and thereby also to enrich our academic program. So all win with this model. So in short, it means that when we look at the research, the students are working, and Dr. Brijlal once again, she mentioned very interesting topics that the students are working on, and also illustrating how they apply their knowledge into the community, into real-world research problems. And for the student, for the teachers, we are benefiting with a seamless integration of research and teaching. So the ultimate goal of this model is to create an inclusive, scholarly building community of knowledge. So when we report, and Professor Geerts and I, we've met earlier this week, and we look at the different data and responses. So there's a correlation. So when we look at the publications and the research projects of the faculty, and the faculty was also congratulated by the HPCSA on the research output, and we can see why. And you can also see the correlation between the research projects and the number of research projects and the number of research publications. So a very productive picture. So when we move to the different research areas and try to find a way to combine the different research areas. So first of all, we have the disciplinary research, and as Professor Geerts mentioned, we cannot box it. We can distinguish it, but we cannot separate it. So first of all, the disciplinary research areas where the disciplines are the starting point, and it can be the interdisciplinary as well as multidisciplinary research, but the discipline is the focus areas, and it is also the outcome of the research. So when we look at the research report on the disciplinary research projects and publication, there's also a strong correlation, but also in terms of the number of publications compared to the number of research projects, a very productive picture in the faculty. So the research report on the research area in terms of disciplinary research, very positive, very productive. When we move to the teaching research area, and we need to distinguish, although not separate, between the teaching research areas. So first of all, teaching research or teaching as research. So you as a lecturer, you research your teaching methods to enhance the learning, to create experiential learning experiences for your students, to enhance the learning outcomes. So that could be interpreted as teaching research. And then also teaching research-based teaching is when your students are involved in research. For example, you are using inquiry-based learning as a teaching method in your research. So when we look at the output in terms of the research, you can see also a good picture. And if you were the teaching and learning specialist in the Faculty of Dentistry, you will also be very happy to see the increased awareness of the importance of research in teaching and learning. Very productive and absolutely commendable in the Faculty of Dentistry. Our students are also involved in teaching, in research, especially in research of teaching and learning. And this is a model not only the faculty, but also UWC adopted in the 2021 in terms of student voice. And you will see at the bottom right-hand side is actually very transformative, where the students identify their own research topics, as in the DRE module of Professor Smith, and they do their own research with the supervisors for the improvement of learning and teaching. And when you look at the output, you also can clearly see that there's an increase in terms of research teaching, as well as community-based teaching, interest in even within the students, interest in teaching and learning. And then the third research area is the community research, is where knowledge is generated for the practical purposes of the community, as illustrated by Professor Brijlal. And here you will also see a very positive picture in terms of research publication and research projects over the last 4 years. Colleagues, now bridging the gap, closing the links between research and teaching, especially in terms of applying the community engaged research model. There are 3 areas, and they're always referred to the triple stack. But when we also already have a triple stack, which I've already illustrated to you. But some more research areas that we have developed in the faculty is in terms of engaged research, research-led teaching, and engaged teaching. So in terms of community, and this links closely with Professor Geerts' presentation, is where we collaborate with the community, and where we, for example, where we focus on disciplinary research, but for the benefit of the community. The difference here is that it's not research on the community. I've explained that in community research, but this is community-based research or engaged research. Here we do research with the community. And colleagues, with this, we're also bridging the divide between academic and the community divide. So we are moving out of our silos and ivory towers and working in the community, as Professor Brijlal demonstrated. So very interesting, there's a shift in terms of the level of engagement and the level of collaboration, as explained by Professor Geerts. So moving more towards engaged research-led teaching and engaged teaching, we are moving to level 4 and level 5 in terms of a high level of involvement with the public, with the community. So in terms of engaged research, as I've explained, it's research with the community and not on the community. So we are in partnership with the community for the public good, and this is how we also contribute to the SDGs. And so when we look at specifically, and it was quite a challenge to identify these publications and research projects that mainly focused on the engaged research project, but also in terms of publications, comparing to the number of projects, a very positive picture. Then research-led teaching is where the existing research underpins the curriculum content, so you can teach your own research findings, or you can teach the findings of other publications or authors. And as Professor Geerts mentioned, is yes, we can distinguish, but we cannot separate. And here's an illustration of that it's integrated and interrelated. And that's why the community engaged research-led model is a good model, appropriate model that we can recommend for the implementation and narrowing the gap between the research and teaching. So when we look at the output in terms of research-led teaching, there's also an increased awareness and increased in output in terms of the research-led teaching. So it's very positive that we have these different areas. So it enables us to focus also and to enrich our teaching. As we said, focus on the clinical care and clinical teaching. And as our previous colleagues, lately colleague Wendy McMillan mentioned, is to render a service. That's what we call chairside teaching. So that could be interpreted as engaged teaching, because we are teaching in the community for the community. I've got it. And
3 minutes, Dr. Lundie.
Good. I'm almost done. Thank you. So and then the project service, for example, Dr. Kabisu with project the Pelopepa train. That's a good example of a project-based service learning, where we also again learn when our students learn in the community, as well as our several outreach programs, as mentioned by Dr. Brijlal as well. So at the end of colleagues, is when we look at, in conclusion, when we look at the trend lines, and I've looked specifically at the closing links, and when we compare the 2018 situation with the 2001 situation, we have definitely, I'm not sure if we have bridged the gap, but we have definitely closing the gap between teaching, research, and the community. And we have done this by using the community, by engaged research-led teaching, as well as engaged teaching. So give me this opportunity to say thank you to the community, that we have the community who wants to partner with us, who wants to collaborate with us. So we are very thankful to the community. Without them, it would not be possible. And also to all our teachers who are integrating their research into their teaching for wonderful learning experiences for their students. And we must also thank you to our researchers as well as Prof Geerts, who for her leadership in creating this platform for us. And also thank you to you for listening to me. Thanks, Professor Titus.
Good. Dr. Lundie, thank you so much for this presentation. I would like to invite any questions at this point. While, people are maybe still thinking of something, I just want to say that, you can see that dentistry has been very productive in terms of its publications, and then two, its projects and that project registration. And I was wondering, Dr. Lundie, is there a support system in place that maybe can be shared across campus where maybe staff are helped and assisted to move from project to publication? Because I see that there's some kind of trend in terms of the amount of publication projects that's been registered and the amount of publications that's also been outputted. And I was wondering whether there's something interesting happening at dentistry on that front.
Yeah, as I mentioned in my conclusion, we have to congratulate the leadership of our faculty. I think within the leadership, Professor Geerts, our research committee, our higher degrees committee, our HODs, there's strong leadership that is actually setting the example for us and support. So yeah, from the structures there are support, and I would recommend that.
Good. Dr. Lundie, there's a question in the Q&A from Mandy Karalison, who is actually asking, do you have an MOU with the various communities that you work with?
Can I ask Professor Geerts? I know we are working with the government. There are service level agreements and so on. But perhaps Professor Geerts, the Deputy Dean, she could perhaps respond to this. Professor Geerts?
Yeah, there's lots of
Chair,
MLAs and BLAs. Yes, please, you are welcome to go ahead.
Yes, can you please repeat the question so that I've got the correct angle?
Yes, so the question, Prof Geerts, is do you know or do you have an MOU with various communities that you work with?
Are you talking about our strategic partners or PGWC, or are you talking about participants of the various research projects and communities where we perform the research?
Mandy, are you able to just elaborate in terms of the question? I'm wondering, Prof Geerts, if this is not a question related to the MLAs and the BLAs, which, where everything is, like Dr. Lundie was saying, it's engaged research, it's research-led, it's community engaged. And I'm wondering if it's that relationship with the BLAs and the MLAs with government that informs how we do research and clinical practice in our space.
At this stage, Chair, our partner, PGWC, is not prescriptive in terms of the type of research that we do. I think to align ourselves to the terms of references of the SDG 3 and 4 and the World Health Organization's terms of references is basically voluntary. But they are very informative in terms of the direction that our research should be going in terms of being relevant and impactful. So it just makes complete sense to follow these directives and these terms of references. But I'm not aware of any formal agreements except the World Health Organization's, where the faculty, in terms of keeping its accreditation or certification as a collaborating center, we need to report on a regular basis on the type of research that we do.
Okay,
Anyway,
fantastic.
I'm not sure
Thank
whether
you.
that answers the question.
I see we've invited Mandy just to ask to elaborate on her question. Mandy, would you like to take the mic?
Can you hear me?
Yes, we can. Thank you.
Hi, thank you. The question was asked because we currently have an MOU with local farming organizations. And so I think my question was more with regards to an actual specific community. So it wasn't with specific organizations, but more so with the actual communities. And just wondering if there was some sort of understanding that the dentistry department has with specific communities. I'm not sure if I'm asking the question.
Yes, I think I now follow the trend of your question. Mandy, I'm not aware of any formal MOUs or agreements with communities. If you are interested, I can actually make contact with the Department of Community Dentistry, who are actually very active in community in terms of doing their research, and there might be some agreements. What I know is that some of the projects by staff are actually sort of piggybacking on larger projects, and they might have not necessarily have agreement, or by proxy have agreements with particular populations or communities where due to the existence of a collaboration agreement with other research groups. But if you are interested in more information on that, please email me. I will try and find out for you.
Okay,
Thanks,
thank you
Prof.
very much,
Geerts.
Prof.
Prof Brijlal, you've unmuted your mic. I was wondering if you wanted to add something. No, muted again. Well, thank you very much for that interactive discussion, colleagues. Thank you, Dr. Lundie. That was a wonderful presentation. And once again, commendations to dentistry for your increased publications and project registrations. Without further ado, we are going to move on to our next speaker, who is Dr. R Maart. She is the head of prosthetic dentistry at University of the Western Cape. She qualified as a dentist from UWC and holds an MPhil in higher education. With a PhD, she developed an implementation framework for an undergraduate dental curriculum to align with AfriMed's core competency framework. Her research interest areas are health professions education, curriculum development, program accreditation, and competency-based education. Her scholarly contributions include local and international conference presentations and publications in national and international journals. With that, I welcome Dr. R Maart.
Good morning, everyone. Apologies, I seem to lost my camera. I think what I would like to do this morning is focus on my specific presentation would be on a project that is quite different from the previous speakers, and hopefully addressing or highlighting how I've addressed SDG 3 quality education via this project. I think I can't move my slide. There we go. Sorry. All right. So what I'll do is I'll highlight some of just the background, just to get everyone familiar with the project. Just to define what competency frameworks are, because we operate and our dental curriculum operates within the competency framework. So it's produced generally by regulatory and accrediting bodies to create a shared model of performance standards of particular milestones along the professional career continuum that we strive to graduate our students with. So AfriMeds is our local South African regulatory body, and they've adopted this AfriMeds framework from the CanMeds, which is a Canadian model, for the HPCSA, which is our regulatory body, to inform how undergrad medical and dental curriculum in South Africa is informed. However, what we need to note is that there's 7 roles and 7 competencies. However, the adaptation of AfriMeds was they have changed the healthcare practitioner and leader and manager, that was competencies that was absent in CanMeds. However, there's no explicit guidelines given as how to implement AfriMeds competencies within the curriculum. There's perceived advantages of these competency-based frameworks it is transparent, it can be accountable to all stakeholders with a shared set of expectations and a common language for education and assessment and regulation, which makes the process obviously much smoother. However, there has been concerns identified within the challenges with the implementation of this competency-based medical education. And there were some authors that have consequently have advised caution to the implementation of these competencies models. So by addressing the challenges in the implementation of these frameworks requires the consideration of implications for the complex systems that we in our education system exist, and in particular in South Africa, it's very complex. You can't separate it, and you can't see education system in isolation. So therefore, my aim of my project, which was also my PhD project, was to develop a framework to align the undergraduate dental curriculum at UWC to the AfriMeds competency framework.
Now you are welcome to start your camera if you'd like to.
Sorry, I'm struggling with my camera. I think I said that in the beginning. Yeah, sorry.
Okay.
So my methodology was in a constructivism paradigm associated with qualitative research approach within the case study as a strategy of inquiry. Design-based research was used to design the framework that can be used in the dental curriculum to incorporate the AfriMeds competencies. So my project was divided into, it was 4 phases. And I will, at the next slide, I will go through the phases as well, because it can be a bit tedious to read it like that. Then the first phase was I evaluated the dental faculty, our curriculum, as the formal curriculum and as it aligns with the core curriculum framework. My methodology I used for that was a curriculum mapping. I used all the modules in the dentistry yearbook, so that would be referred to as the formal curriculum, which included 59 modules. Then the second part of my first phase was that I explored and described the dental educators' knowledge and views of the AfriMeds competencies and their implementation thereof. For that section, for that part, I did focus groups of 4. Focus group of between 6 and 8 lecturers and 2 focus groups for that data collection. The staff that I've used was permanent employed, and they all were module coordinators. Then my second part of my study was to determine strategies of how to implement the core competencies in the curriculum. For that part, I used the systematic reviews and that the literature is used for that. Third part was to design a framework to align and implement the competency frameworks. And the methodology I used was document analysis, and the document that I've used was the data that I gathered from the previous studies. And lastly was to test the feasibility of this framework or model by means of a Delphi study. And for that, I used expert panel members and academics nationally. So I'll briefly just go over these results. This is the result of the curriculum mapping. So the roles of the AfriMeds was colored, were differently colored in order for us to easily pick up the maps and see where and what we are doing the most. So if you briefly look at the map, what we've discovered, looking only at the roles of the AfriMed's roles, the competency roles, is the blue is very prominent, and that is the health care practitioner, healthcare professional. So those are from first year right to final years, that is strongly associated. So it's clearly present and aligned with the competencies. Far and in between, you can see from the colors, your scholars, that is green, professionalism, and also health advocate and collaborator. Those are ones that it's sparsely displayed, and those would then definitely, you can look at the advantages of the mapping is that you can clearly see where the gaps are and how the integration is, not only horizontal but vertically. You can clearly see how this translates into the curriculum. Then my next phase, the focus group interview, that was quite insightful, having to talk and discuss that with my colleagues. So from the findings, it suggested that although the dental educators required some guidance and clarity regarding the AfriMed's core competency frameworks, they were, however, able to identify the competencies. What this stage of the study highlighted was the importance of engaging all stakeholders, and especially your dental educators. And for this sake, you could also refer to them as your community. The dental educators were able to reflect on the dental curriculum, as well make valuable recommendations about other inclusions, integrations, teaching and assessment of the core competency, as they were all module coordinators as well. These recommendations for undergrad dental curriculum at this selected institute included the role of the collaborator that needed to be reviewed throughout the curriculum. Also, teaching and learning and assessment of the communication and professional competency also needed to be reviewed. And future curriculum review process, therefore, would need to be informed by the requirements of the HPCSA, as well as the institution-specific requirements to achieve a coherent and integrated curriculum. Then the third part of my study was a systematic review. My question was, what are the strategies used to develop the core competency in undergrad dental curriculum? So then I consulted the literature, and I include the databases I included, and then a meta-analysis consisting of a descriptive meta-analysis to critically analyze and discuss the emerging themes. Strategies used to develop core competency were divided into 4 components, namely organizational structure, faculty development, teaching strategies, and assessment strategies. There was a strong relationship between the suggested implementation strategy from this systematic review findings with a multifaceted approach that was suggested for the CANMEDs. Teaching and assessment and faculty development strategies were common ones that we found in the literature. However, organizational structure changes were not included as an implementation strategy of CANMEDs. So these are the 4 themes, the 5 themes that came out of the discussions, is that organizational structure, faculty development, teaching strategies, and assessment methods need to be considered and incorporated when you are considering implementation of competency frameworks. Lastly, the third part was my document analysis, where I took all the evidence that I've gathered. So the first phase was I looked at best practice, which was referred to the literature, and then the second stage was that I used the data from the previous study. So it was a systematic review, it was a focus group interviews, and the curriculum mapping, where I looked at all of them by looking at data document analysis, then to develop the model. So the step 1 was looking at the best practice, your literature, and step 2 was looking at the evidence. So I gathered evidence from the literature, from our curriculum, and with our dental educators, and developed the framework. So the framework, it speaks to the influences of the external parties, the external stakeholders. So in this case, we looked specifically at the council. So it was the HPCSA its competency framework. However, from the literature and the previous study and the evidence gathered, my model proposed that we also consider the individual institution influence on any changes on your curriculum as well. So in this case, our specific institutional framework needs to be considered. So our ILP, our graduate attributes, our decolonization of the curriculum that strongly that we need to transform, impacts on the dental school. And in this case, for any change to happen, the leadership needs to be supported, need to support the strategy or the implementation. There needs to be a diversity of involvement of internal stakeholders on all levels in order for this change to really transform and to be impactful. Once that level is completed, you need to, or the model suggests that you include faculty development of the core competencies, teaching strategies associated and assessments with that. Also, your teaching and learning needs to be considered and aligned, and then your curriculum needs to speak to the changes and incorporation and identify the gaps that was identified by the mapping to incorporate it into the curriculum. So the Delphi study, after I have developed the framework, I then, this was the final stage of my study, the Delphi study. This was the study flow. There was 2 rounds of the Delphi studies, and we had a consensus of 70%. The first round, 2 questions, 2 statements were not, those are highlight, were not, did not reach consensus. Therefore, it was modified and then resent for the second round, and then the statements were, consensus was reached. Therefore, I concluded that consensus was reached. And of those who disagree, dental experts expressed their concern about the dental academics, especially junior academics, their knowledge of AfriMeds and how this translates to meaningful attributes for their students. They expressed concern that dental academics are only trained in dentistry and not as teachers. They also, in this study, supported faculty development, especially in teaching and learning, and would benefit the transition of competency-based education and alignment of the core competency framework. And from the comments, it was suggested that the AfriMeds competency framework was not completely understood and integrated in the dental curriculum was only a superficial exercise that relates only to the council accreditation process. The inclusion of all dental academics in the workshops have the potential to facilitate the success of the implementations of the AfriMed core competency framework across all 4 dental schools. And this in turn would have allow for more meaningful engagements of the dental academics. And since the institutional frameworks and the context specifically of dental schools vary, this needs to be considered and included in the HPSA accreditation process as well. And just to conclude, my last slide is the gathering of evidence that I had specifically to lead educational change could be translated to any other change that is necessary. This is my suggestion. That the advantage of this framework is that it's a dynamic. You can add external factors. It's agile. You can move. You can have various aspects to it, but in its ability to lead systematically any transformation that is required at the moment. it is responsive to internal and external factors or influences or the context, and it navigates the educational change necessary in a very systematic manner. Thank you.
Dr. Maart, thank you very much for a very insightful presentation, and it gives us a really nice overview of your PhD and the value and the input that it has on, you know, developing new knowledge. So thank you very much for that, and very well done. Are there any questions for Dr. Maart at this point? I'm going to ask a question, but it's, yeah, I don't know if it's as relevant now, but you know, the idea around best practices, and you know, initially I started thinking when you started speaking around these specific core competencies, and I was wondering which ones had obviously emerged stronger in terms of scholar, communicator, collaborator, but I think you've shown the, you know, that grid specifically. And then, you know, when you spoke about best practices and that best practices emerged from the literature, I wanted to know, linked to the fact that, you know, we're speaking about the AfriMeds framework, which is sort of very responsive and very contextual for our context. Whose best practice is best practice? You know, whose literature is it? Whose voice is it? You know, is it the voice of Africa, or is it the colonial voice? I'm sorry that I'm asking a controversial question.
No, thank you for opening up this, Professor Titus. I think the wonderful nature of being immersed in literature and looking at evidence is that you also see the gaps. And the gaps was the voices of Africa is absolutely missing. So I found it very difficult to incorporate because I couldn't find any literature specific. However, following from this, the next phase that I have, or I am trying to submit, or have submitted, looking at the PhD and the evidence differently, looking at the gaps, specifically with the decoloniality lens, because it is responsive. However, we need to create our own evidence in order to be responsive. So these voices in the PhD is not there because I couldn't find anything in the literature. So I've highlighted the gaps within my research, that the need is there. And so at the moment, we are a few African dental schools looking specifically to create new evidence, to have evidence for our context specifically. So yes, no, it's not a difficult question. It's right up my alley. Even deconstructing the competencies, just adapting it from the north is not okay for me personally, because it's my personal view at the moment. So that deconstruction is the second layer, but it was good for me to understand the context that we operate in before immersing myself, you know, to be more responsive to our specific context.
And you know, the work of Alan 2020 speaks about how we've migrated. So we migrate from CanMeds to AfriMeds framework, and then speaks about transforming and redesigning. And often they find when you redesign something, you know, the longevity of a redesigned framework, you know, is a lot more impactful, and a lot more longevity is attained by doing that. So yeah, thank you.
And I think that the next layer is, you know, the voices. What voices do we use? And the voices of the students, which is also our community, besides the teachers. That's why that was so important, because they are not recognized often enough. And so the model allows, or the framework allows those different influences, and hence I think it's a good, or obviously I think it's a valuable tool to use for any transformation going forward, because it's supposed to be, or it implies to be inclusive.
And it's agile.
Absolutely.
Yeah, good. Very impressive. Thank you very much, Dr. Maart, for that insight. If there are still any questions, you're welcome to post it in the Q&A. But I think for now, you are right on time. Thank you so much. For now, we will move on to our next speaker. I would like to introduce you to our last and final speaker, Professor Manajari Chetty. She is a board-certified oral pathologist currently employed in the Faculty of Dentistry at the University of the Western Cape as HOD of the Department of Craniofacial Biology, which includes forensic odontology and genetics. She was introduced to the world of human genetics in 2012 and subsequently enrolled for a PhD in the Division of Human Genetics at the University of the West of Cape Town. She's the first specialist oral pathologist to obtain a PhD in human genetics in Africa. A need for designated dental craniofacial genetics clinic was identified at UWC as there was no existing referral pathway for patients with genetic disorders. The clinic serves as a referral center for patients with genetic conditions affecting the craniofacial complex to be managed with regular follow-ups. The focus of the department and an initiative led by Prof Chetty is to address the need for the development of the dentist-scientist career pathway in Africa, since the future of evidence-based dentistry in South Africa and Africa depends on sustainable establishment of a dental scientist workforce. Just as physicians envision a future of personalized medicine, where one-size-fits-all model of diagnosis and treatment are a thing of the past, the same strategy is also emerging as a new field of personalized dentistry. And with that, I welcome Professor Chetty.
Good morning, everybody. I apologize for that long bio sketch. Melody is going to actually be sharing my screen because I'm unable to do it from my side. So my talk today is entitled Developing the Research Niche Areas and Teams. And actually, it's a documentation of my academic career, which began a little bit over 10 years ago. The next slide. I've listed some objectives that needed to be attained in our quest towards identifying the research niche, which we had to attain and then subsequently consolidate a team so that we could develop and expand this niche. Let's go on. The next slide. I was employed at the Faculty of Dentistry in 2010, just after I had qualified as an oral and maxillofacial pathologist. At the time, there were no posts available in pathology, so I took up a post in the Department of Oral Biology. And at the time, it was just a single-person department, and I was given the mandate of developing the course to align with national and international trends. So that initial year was basically a time of reconnaissance in which I just did undergrad and postgrad teaching. And what I found was that in most dental schools, the basic health sciences subjects were usually tutored in the medical faculties. And we had just now taken over teaching that so that there was easier integration of these students into the discipline of oral health training. It was very important at that moment to look at where oral biology began in the world and why did it develop? What was the need that it was addressing? It was developed in order to conduct research and provide basic oral science education. And oral biology, subsequently at UWC, was found to be ideally placed since it bridged the gap between the basic sciences and the clinical modules. At the time, we were also regarded as the largest dental school in Africa. Go on, next slide. And being the largest dental school in Africa, it sort of made one think, There were large projects being developed and going on in Africa, for example, the H3 Africa project, and no oral health involvement was invited. There were findings in the Cradle of Humankind, you might remember the Homo naledi one. And even then, no oral involvement or dental involvement was invited from anywhere in South Africa. There were genome-wide studies done on oral health conditions, but nothing in Africa. And forensic odontology, which is also a niche that we find at our faculty, included no molecular biology at all. So basically, in South Africa, translational oral health research had not as yet been incorporated into the undergrad curriculum. Now, we do have a research module in the undergrads, but it is not to the extent of incorporating the most recent science and incorporating, for example, the recent technologies. The next slide. To determine where we needed to go, we had to look at what had happened over the last, for example, 30 years. It was found that the scope of oral health basic sciences, research and training had expanded immensely. And in developed countries, basically, oral health had benefited from the advances in these technologies. We had not caught up. In South Africa, in the rest of Africa, we had not caught up. And some of the milestones that were achieved and that we needed to basically attain or work towards was the identification of cranial neural crest cell derivatives. We know that that is fundamental in the craniofacial development and subsequent dysmorphology, if there's any. The approach to the management of patients with oronasal and craniofacial abnormalities needed a multidisciplinary approach. So while you might get human genetics and you might get pediatricians dealing with these patients, it was very important for there to be dental involvement. The disciplines of genetics and molecular biology, paleoanthropology had expanded vastly. We needed to catch up and include these into our curriculums, especially the advances in gene sequencing and stem cell research, MRIs and CT scans, which I think we have incorporated. Now, identifying these milestone achievements kind of informed the decision to then embark on a PhD in human genetics, which I did from 2012 to 2016. Next slide. And at 2016, it became imperative to address where we were. In the department, in the faculty, we did a kind of SWOT analysis, maybe not at the level that it's done sort of formally. And we found that the Department of Oral Biology, some of the conclusions that we arrived at was that the future of evidence-based dentistry in South Africa depended on a sustainable establishment of a vibrant dentist-scientist workforce. Many dental schools in South Africa and the rest of Africa have not as yet risen to these challenges. And hence there's a decline in research output at the molecular, scientific, technologically informed outputs. I think the most important conclusion was that there was an overdependence on findings from technologically advanced countries. And this was with regards to our management of patients, protocols that we followed with regards to management. And next slide. Some of the literature, I've just put in a few articles that kind of informed the development of this research niche. And it was obvious that we needed to work towards including some of these findings that the First World had into our curriculum. But the most important thing was we needed to do research for Africa. So in Africa, for Africans. I'm just going to read 1 or 2 lines from these. And many of those students are actually registered with us with regards to their PhD projects. So I'm thinking it's still early days. We are providing the evidence and the need for it. And I do think that eventually it will take off slowly.
That's good. Thank you
Obviously,
very
lots
much.
of challenges like funding and things like that.
Yes.
But we're getting there.
Yeah. Yes. Look, and I think Dr. Lundie is also, echoing my thoughts. So he's saying excellent work and leadership. Teamwork makes the dream work. And absolutely, I can see how you went from a one-person department to, you've really flowered. So thank you very much for that and the insights. And I think that, how you've led this process, can be shared with many other departments and niche areas in across campus. So thank you very much for your contributions. And with that, colleagues, I'd like to thank everyone for your participation today and for your attendance. Melanie, if you can just put up the last slide for me, please. So yes, thank you very much to all the presenters for your insightful presentations today. I've learned so much. And to the attendees, thank you for taking the time out to support colleagues and to listen to these presentations. And lastly, thank you to the DVC of Research and Innovation for allowing us to have this space so that we can start sharing and disseminating our knowledge. Colleagues, I just want to alert you to the next session, which will start at 1 o'clock, which is the second session of day 4, which is the, with the Faculty of EMS. And yes, thank you very much. Have a wonderful day. And yeah, go forth. Bye.